let's have a closer look at Article 11 of the UN Convention on Rights of Persons with Disabilities, the UN CRPD. The UN CRPD is a human rights treaty for persons with disabilities. This binding United Nations document is signed and ratified by all EU member states and the EU itself. Article 11 establishes that states must ensure the protection and safety of persons with disabilities, including people with psychosocial disabilities, in situations of risk such as armed conflict, humanitarian emergencies, and natural disasters. It means that during these situations, for example the COVID-19 pandemic, people should have full access to health and other services without any barriers. It also means that states should develop emergency plans that are inclusive of all people in society. States should protect all against negative attitudes and stigmatization that may arise in a crisis. Remember Amy and Victor? Amy and Victor happen to have a psychosocial disability. A psychosocial disability is a long-term mental health problem which, when combined with barriers in society, becomes disabling. During the COVID-19 pandemic and the imposed lockdown, Victor lived in an institution. He was at increased risk of contagion due to the overcrowded environment in the institution. He was not allowed to receive visits from his family and friends anymore. He did not receive proper information on what was happening, and his treatment had to be interrupted due to staff shortages. For Victor, this was a very difficult time. He often felt isolated and was scared of what would happen next. Amy, in turn, was living at home, receiving support within her community. Through online networks, her peer support group immediately shared transparent and easy-to-understand information about the lockdown with her. When the government started deciding on the lockdown measures, she was invited to contribute to the discussion as an expert, a person with lived experience. Her treatment continued through telemeetings. Now, Amy is back to in-person meetings with her therapist. She continues to be involved in political discussions regarding the long-term solutions to the crisis. Unlike Amy, persons with psychosocial disabilities have been affected by the pandemic more than others. They face exclusion and poverty as a result. We need to ensure that in situations of risk, the protection and safety of people with psychosocial disabilities are guaranteed without discrimination. Find out more about the rights of people with psychosocial disabilities in situations of risk at www.mhe-sme.org.